Good morning, guys. My name is Megha Anil Kumar, and my roll number is 22 MPSY 33. So, in this video, I'm going to talk about the modern methods of performance appraisal in mental health practitioners. So, I'll first be explaining what is performance appraisal in mental health practitioner setting, and then I'll be explaining five modern methods. That is like there's a difference between traditional and modern methods. So, five modern methods is what I'm going to explain in this video. So, what is performance appraisal? So, in the context of mental health practitioners, it refers to the systematic evaluation and assessment of professional performance, skills, and competence. That is, if you're working in an organization or an institution, your performance, your whatever you are providing to the organization, it is being evaluated, where your skills are evaluated, your competence. Competence is the area of expertise you have, the trainings you have, how better or good you are in performing your performance, professional performance. All this has been evaluated by the organization, whether it is meeting the needs, vision, or mission, or the goals of the organization, or whether it's meeting the proper client outcome. So, performance appraisal in a mental health practitioner or in a mental health field is like evaluating the like your interventions, or being a practitioner, how well are you at your performance, and you'll be given feedbacks based on it. Now, the difference between modern methods versus traditional methods, and why I've been explaining this is because when we say the modern methods, the how much it have developed and how much area it's covering, and the pros when compared to the traditional methods, and why this change is very important is to be known. So, in modern method, when we talk about the modern methods, usually they are more, more holistic evaluation. And when I say that, it's like traditional methods are mainly, more rigid and hierarchical. Like it is more manager centric, or it is more like the seniors evaluating you more, and more feedbacks are not taken from the clients or your subordinates or even your peer groups. But when it comes to modern methods, you can see why it is holistic is because the way of evaluating is more like the feedback is taken from every areas, where multiple sources are being considered, and also it's not just like annual or semi-annual reviews. It's more like you're focusing on a continuous feedback. You are given more feedback as you perform. You're given as the time goes by. You have to be like, your adaptability is checked. Your it focus on more future potential than just on the past performance, like how you can better your outcomes. So that's the difference between modern methods and traditional methods, where modern methods are more holistic, and it's like a continuous feedback method, and more collaborations can be seen. And it's not just like rating scales or ranking, where traditional methods were more like rating scales and just ranking, where you're rated. It's more like giving you feedback based on each area where you have to be developing yourself, where development is required, and how well you can improve your performance. And just doesn't focus on criticism. It also focus on the you know betterment that has been shown in from the past performances, and all the strengths are also focused. So it's just both pros and cons. So that's the difference, and the main focus when it comes to the differences. Now, the first method we are going to talk about is a 360 feedback method. And as I mentioned in the holistic approach, you can see 360-degree feedback method is more like a multi-perspective performance appraisal approach, which means you gather informations, feedbacks, and inputs from various sources. That is, from your supervisors, from your subordinates and peer groups, and even sometimes clients or patients. You're taking in a 360-degree way, where your feedback based on your performance, and the evaluation is done from every aspects around you that is connected to you and your performance. And when I say it's not hierarchical, that it's different from the traditional method, is where it's taken from your superiors, your inferiors, and also your same like your peer groups, the ones who are performing, or the same, if you're a psychologist, also the other psychologists where you usually go for what do you say, like to discuss on cases and case reviews. And also it's taken from your clients and patients also sometimes, because we need to know the client outcomes and where you need to better yourself. So that's what 360 feedback method is mainly focused about. And the good thing about it is it's a multi-perspective performance appraisal approach. And, it's like a well-rounded view of their strengths and area of improvements. And also 360 feedback method is mainly, you can say it's done anonymously, because then they can be more open-minded. They can be more truthful about the feedback, where they don't have to hold back themselves, uh, fearing how would they see it, or how it would be affected. So you can see like the feedback is going to be way more uh, integral. So that's the best part of 360 feedback method, being confidential. Now, the next one is clinical supervisions, and it is where, like, the mental health practitioner receives guidelines and feedbacks and support from an experienced supervisor or peer. Like, it is like, you have a clinical supervision where you are taking a review, or you're taking guidance and feedback from someone, either your peer, someone from your peer group, someone who's working along with you, who can give you uh, better advices, or a supervisor who has well knowledge and expertise in it, where you can get expertise advices based on it. And it this will help you talk clearly more, ensure your ethical practices, which will promote your performance, and which will help you, like, which will help you know where you need betterment, where you need to show much more improvement, and it can help you gain more knowledge, and it's like an expertise advice which can help you. So it is like, even based on your client issues, you can approach them to get more better advice on how you can deal with it, and if you are having doubts or issues with it. The next is outcome measurement tool. And in outcome measurement tools are like modern methods where they focus on assessing the effectiveness of their interventions and also the impact on the client well-being. So the tool helps mental health practitioners evaluate the outcome of the interventions, track progress. Like, if suppose your uh, client, and you, like, they come to you based on the issues like having, maybe based on anxiety and depression, so you give them a standardized assessment tools actually to measure their like what is happening to them. It is more evidence based, and it can more support your interventions. And even after few months, through your therapy sessions, you will again evaluate them and take the measurements, so that you can know if there has been any enhancement in their well-being and how well they are doing. And it is more like evidence based, and you can have a time to time feedback on how the performance is going, which can help you in your performance appraisal. The next one is emphasis on well-being, and this approach recognizes that mental health practitioners must maintain their own well-being to provide effective care to the clients. And it involves evaluating not just clinical competence, but also factors such as work-life balance, self-care practices, and burnout prevention strategies. Because it's like an emphasis on well-being, where you need to be good, you need to be in a better position mentally and physically in order to provide care to your clients and for better client outcomes. So it is like, it is a measurement where your emphasis is gone, like, emphasizes on the well-being, where you can actually measure even where you're having burnouts, and you can also bring up prevention strategies and work on it. So it is very important. This approach is very important, because only if you maintain your own well-being, it can help you provide effective care to the clients. Now, the last one is ethical assessment, and it is very important because ethical consideration is very important being a mental health practitioner. And here we can see where ethical assessments involve evaluating mental health practitioner actions, decisions, and behavior to ensure they align with ethical principles and code of conduct in the field. So these assessments actually measure whether you are following the ethical guidelines, and you will be supervised through other supervisors whether you are ensuring it. Even client outcomes and client, what do you say, maybe anonymously, they will be seek their feedback based on whether the ethical demands, even when it comes to client care, is being held, or it is being taken care of. And also supervisors will be assessing you, and also a self-assessment where you can also meet others, take advices from the superiors based on the your issues you're facing with ethical dilemmas, and how to overcome them. So that is where ethical assessment mainly focus on, where your decision, your behaviors will be assessed whether it aligns with the ethical principles and code of conduct in the field. And it is done to ensure the client is safe, and like all the actions or the interventions are done in a safe manner.
Yes, I'm going to continue speaking about the modern methods of performance appraisal. Peer review and consultation. Here, an employee's performance is evaluated by their colleagues or peers. Feedback may include the individual's skills, teamwork, and communication. They can also seek advice from experts or colleagues, and they will assess their ability to collaborate, seek guidance when needed, and make informed choices. Goal setting and development plan. Here, employees and managers collaborate to set clear, measurable, and achievable performance goals. Development plans focus on the employees' skill enhancement by providing training, workshops, and monitoring their work. They are also able to acquire new skills and gain knowledge through goal setting and development planning. Self-assessment. Here, they reflect on their work over a specific period of time. They may consider their accomplishments, challenges, and contributions. Certain companies use assessment forms which help guide them through the evaluation process. They are asked to assess their performance against the goals and expectations set at the beginning of the appraisal period. Self-assessment encourages self-awareness as well as introspection. The employees are able to give their perspective, and they are held accountable for their performance. Continuous training and education. Here, the skill development in continuous training and education helps them to acquire new skills. When it comes to career advancement, it helps them enhance their qualification and increases the chances of promotion as well as getting better job offers. Continuous training and education fosters innovation by exposing individuals to new ideas and perspectives, and it also encourages creative thinking and problem solving. When it comes to regulatory requirements, it helps to maintain certifications and licenses which are required by some professions. It also helps provide a sense of accomplishment and purpose. Client feedback. Here, the clients provide objective perspective on an employee's performance. They can rate the employee's communication as well as empathy. They can give their feedback on areas they think that need improvement, and they can also give continuous feedback. It doesn't necessarily mean that they have to give their feedback at the end of their treatment. They can give it throughout, as well as they can give positive feedback about the employee, which can help us recognize the good work of employees. In conclusion, performance appraisal is important because it helps us get feedback about an employee's performance, about their communication. It helps us set goals. It helps us to analyze the strengths and weaknesses of an employee. It helps us with giving rewards and recognition to the deserving employees. This helps with continuous improvement. It holds the employees accountable for their work, and it also enhances motivation and engagement. Thank you.